Thank you all for attending this webinar on attacks on healthcare in Gaza and Palestine. I would like to give a few minutes of introduction to the event that we put together in a very short period of time. My name is Sausan Abdulrahim. I'm a fellow in the Palestine program and Health and Human Rights at the FXB Center for Health and Human Rights at Harvard School of Public Health. And I want to thank my colleague Nadine Bahour for helping in putting this webinar together. Please, throughout the webinar, if you have any questions or comments, please write them in the Q&A, and we will pay attention to all of your questions and comments and address as many as we can at the end of the webinar. I want to thank all our speakers, and particularly the speakers who are on the ground and who are busy with life-saving activities right now, who are taking the time to be with us to help us know more about what's, the situation and what's going on right now. But I also want to thank our colleagues from WHO and from the Rule of Law Center. Let me start by very quickly, I don't want to repeat a lot of the information that our speakers will address, but I want to mention that in the last 3 weeks, as of yesterday, we actually have been in a really horrific situation of counting the numbers of those killed or injured every day. As of yesterday, we have more than 8,800 Palestinians who have been killed. Around 40% of those are children. Whilst the number of those who are killed and injured is highest in the northern part of Gaza, actually almost 30% of the deaths are in the central and southern parts of Gaza, where people have been told to flee in order to seek safety. There have been more than 58 attacks on medical facilities, which our colleague from WHO can talk about more. 132 medical personnel have been killed in the past 3 weeks. Our colleague from Al-Shifa Hospital, actually he's a former colleague of mine, Dr. Ghassan Abu Sitta. We tried to get him to provide a recorded intervention for today's webinar, and he agreed actually a week ago. But unfortunately, we have not been able to reach him again. He's been extremely busy. I know that he finishes a shift in the operation room at 2 a.m. every day. What we are witnessing in Gaza is a violation of basics of human rights. 3 weeks ago, Yoav Gallant, the Israel's defense minister, announced Israel's plan to institute a complete siege on Gaza, depriving the population of food, water, and electricity. He was not kidding. That has been happening over the past 3 weeks. And this has been causing tremendous human lives lost and tremendous, basically, violations of human rights, whereby we have, what we will talk about today is a focus on the impact of the siege and of Israel's bombardment on healthcare facilities. Last night, the news reported that the Indonesian hospital announced that its main generator has run out of fuel and that they will start to rely on a secondary generator, which will not be sufficient to cover all the hospital's needs. So the hospital will start to operate without lights, without oxygen supply, and without refrigerators functioning. The situation is similarly disastrous in Al-Shifa Hospital as well. It is currently using fuel donated by members in the local community, not by the international community, and it will run out in a few days as well. The overwhelmed health institutions has caused serious disruptions to primary healthcare services. Let us not know that the impact of this bombardment is not only on death and injuries, but also on the disruptions of routine activities, routine health system activities. We have a disruption in maternal and child health services. We have 50,000 pregnant women in Gaza who do not know whether they will be able to deliver their babies safely or not. Childhood immunization services have been disrupted. Patients with chronic conditions are worried about their ability to continue to receive treatment for things like kidney dialysis or cancer treatments. Israel's siege on Gaza is not only destroying healthcare systems or healthcare institutions, it's actually destroying the health system as a whole. It violates basically the bombardment and the destruction of the water infrastructure and depriving a population of water and fuel is violating the basic conditions of life. Currently, there is a threat of the spread of infectious diseases. There's a threat of cholera epidemic, given that a large proportion of the population is currently not able to access clean water, and some children are drinking brackish water or seawater. And this is aggravated by cutting off fuel, which is preventing Gaza from desalinating water in order to provide for the population. What we are witnessing is a clear violation of international humanitarian law that is impacting every aspect of people's lives and well-being. We put this webinar together in order to be able to really understand what is happening on the ground and to be able to share this with an audience, with American taxpayers, with the students, and with faculty and with staff at Harvard, in order to, hopefully at the end, try to and start a conversation about our responsibility to end the siege and to end the bombardment of Gaza at this point. I'm not going to speak for more. What I'll do is I want to start introducing our speakers. The first speaker is Omar al-Najjar, who, again, I want to thank Omar because he is on the ground working in an operation room, in an emergency room. Omar is a medical doctor. He's a medical student, and he is one of the students who took a social medicine course that the program and the Palestine program on health and human rights offered this past summer. Omar has been on the ground working in emergency rooms, trying to save as many lives as possible. And what I'd like, Omar, for you, if possible, to address your experience in the emergency room over the last 3 weeks, please. If you can do that in the next 5 to 6 minutes, please.
Okay, thank you. Thank you all. I'm Omar Najjar. I'm 24-year-old. I'm a medical intern doctor at Nasser Medical Complex. I've been here for the past 2 days of since the second days of the war, for the past 3 weeks of the war, awake and sleeping here. The situation in Gaza is tragic. I believe most of you have seen the images coming from here. The hospitals has turned into a shelter for thousands of people lying on the ground, in the courtyard, everywhere actually. We can barely move within the hospital itself. Israel have violated every single law, including health violations. There's about 16 private and governmental hospitals have ceased operations, including the only cancer hospital in Gaza, the Turkish Friendship Hospital, where the third floor was directly targeted. Additionally, about 32 primary care centers out of 50 were affected. Israel directly targeted Al Ma'madani Hospital, the only Christian hospital in Gaza, and killed more than 500 people. Many hospitals, including Al Quds Hospital, affiliated with the Red Crescent, have been threatened with evacuation and have been shelled multiple times. Today, it was targeted with live ammunition, caused injuries to people inside it. Israel killed about 24 doctors, 50 nurses, 10 medical students. Based on the number we have collected, uh, all of these 24 doctors and 10 medical students are colleagues of us. We know them. Uh, Israel has imposed a 17-year-old blockade on Gaza, and what's happening now is a blockade within a blockade. It's not an exaggeration to say that there is not a drop of fuel has entered Gaza since the beginning of this war. Some hospitals have stopped functioning because of this. Our hospital, Nasser Medical Complex, has run out of fuel storage, and we are operating now as the bare minimum on donations from the private stations here in Gaza. For example, there is no daylight, there is no AC, even in the operation room. Today at the hospital, I work Nasser Medical Complex. There is no water running in the tapes in the departments. I had to go to another section at the far end of the hospital to get water for washing. Medical supplies are running out. In some cases, personally, I couldn't find stitches to suture the wound or bandages to stop bleeding. The Israel occupation directly targeted ambulances and paramedics. Uh, Around 28 ambulances were directly targeted. Patients with the chronic diseases in Gaza are suffering. It's a totally different story for those people of chronic diseases. For example, my father's diabetes treatment ended yesterday, and if I weren't a doctor with connections here in the hospital, I wouldn't have been able to provide the treatment for him. I can recount dozens of other violations. What I want to say is that I've witnessed all of this, witnessed hundreds of massacres being committed, witnessed dozens of children as the sole survivors of their family, witnessed dozens of families completely wiped off the civil registry, also witnessed the using of internationally banned weapons, witnessed death by suffocations, horrific burns that consuming entire bodies, a 100% degree of burns, witnessed gouging eyes, amputated limbs, all of these. So that's it. This is the health reality here in Gaza.
Thank you so much, Omar. Thank you. As I mentioned earlier, this webinar was put together quickly, and we completely understand that the former students that we've invited to give testimony in this webinar may or may not. We knew that ahead of time that they may or may not be able to join us. So we have invited Noor, and thankfully she is able to share her experience with us. Noor, if you are there, Noor is also a student, someone who took the social medicine course that the Palestine Program on Health and Human Rights offered this last summer. And she is a medical student in the Gaza Strip. Noor, if you're there, can you please share again your experience being part of the healthcare system at this time? I don't know if Noor is speaking, but she is muted. Okay, now.
Oh, hello? Can you hear me?
Yes, please go ahead, Noor.
Okay. Hello, I would like to start with sending my greetings from Gaza, Ard al-Izzah, that's how we like to call it, Gaza, the land of pride and dignity, where we are now. Right, yeah, what the problem in Gaza is not something that just started like on the 7th of October. It did not start with these aggressions. We have been living under a blockade for almost 2 decades now. They have been calling it an open air prison, but I personally disagree with that because I don't see anything open about this air. right now I'm talking to you under the sounds of F-16s, F-35s, or whatever. Like these air forces are on the skies right now. They can literally bomb any of us at any second. Even when I'm talking to you, they literally also, like, as I was waiting on my turn, they bombed somewhere close. We don't have Wi-Fi. We don't even know where that was. And we can even hear, I don't know, like the killing of any of our friends or relatives at any second, because this is what has been happening in the past few days. And us being under blockade means that Israel decides how much food is allowed into Gaza, like literally the number of calories. You can read about that. They can decide how much water is let into the Gaza Strip. Like we have in our houses, we have like tanks that we can fill in. That's like they tell us, oh, the water has come. That's like this happens like once every week or every 2 weeks. Since the start of the aggression, this has never happened. So we ran out of water at houses. Again, also in terms of food, they haven't allowed any food, and also only some humanitarian aid that was allowed late to come through the Egyptian border very recently, but it is not enough for anyone. We have to, like, I personally have to stand in line for like 6 to 7 hours every day, 5 hours if lucky, at the bakery. And my brother goes to like bring in a little bit of water, drinking water for us, like at home, and that's if we're lucky and we get some. Sometimes we just, when it's my turn, they already ran out of flour and we can't get any of that. They also bombed bakeries too, so that was like a matter of like us surviving that. They did a lot of massacres in my own street, like literally places where I was walking. I lost cousins, I lost friends, I lost classmates at med school. I lost Bisan with her whole family. Doha with her whole family. Marah is the only one who survived in her whole family. I lost professors. Hospitals have been running out of supplies. Have been running out of fuel since October 7th. They have not let any fuel into the Gaza Strip. So many hospitals are already shutting off. Like the Indonesian hospital today, they shut off. They're only working on an alternative motor for like power, and so many patients are suffering from that, obviously, because the ICU depends on that. The dialysis patients depend on that, but that's also like a horrible situation. Also, there is the Turkish hospital that's right next to my med school. They have directly bombed that hospital, so it's also running out of service. And the Turkish hospital is the only hospital in the Gaza Strip for cancer patients who also rely on leaving the Gaza Strip and go to the West Bank or East Jerusalem to get their treatment, because treatment is not allowed into the Gaza Strip, or radiotherapy or any of that. So they need a permit like to go into that, and that's a whole different story. But that's even in, I don't know if you call that normal, but that's before the aggressions. Right now, nobody can leave. They only allowed a few of the injuries, like very, very few numbers, very few numbers. They're talking about more than 20,000 injured patients in Palestine. They allowed like, I think like 80 yesterday and around 40 today. So like very few numbers to go leave through the Egyptian border to get some treatment outside. But cancer patients are not living, so they can't get the treatment right now. You're talking about people with chronic disease who are not getting access to their medications. You're talking about inside like the hospitals, we don't have like when we're working there, when we're volunteering there, we are running out of like even sutures, no sanitation. You just like, I don't know, you run from a patient to another because there's so many casualties, there's so many numbers of patients coming in at the same time, and running out of tools. Staff are getting tired and exhausted. And I don't know, so much is happening all at once right now. But yeah, but it's not. But as I said, like it's not a problem. It's not about what's happening now. This is a continuation of a blockade that has started, but now it's even more than that. And there is no place to evacuate. There's no place to leave or whatever. So we don't have any other choice but to remain steadfast, and that's what we're doing. People in Gaza are remaining steadfast. And in the middle of all this, we don't even have time to cry or grieve over any of those who we lost. We can only remain steadfast, and that's what we're doing.
Thank you, Noor. Thank you. Hassan Abu Sitta, our colleague who is a plastic surgeon working in Al Shifa Hospital, agreed to record a segment, like a 10-minute segment, and share with us, but he has not been able to do that in the past couple of days. So what we will do instead is we'll show just a 1-minute clip that we got from the web of him basically talking about the situation in Gaza. It's a little bit outdated. The situation is much worse now than when he described it about a few days ago. So we'll show this clip now.
We will not leave. There's no possibility of moving this number of critically wounded patients. I'm currently at Shifa Hospital, which is Gaza's largest hospital. The situation here is absolutely dire. The hospital used to have a bed capacity of a maximum of 700. I think we have now around 1,700 to 1,800 wounded patients. We have to put in corridors on the floors, in the wards, in the emergency department on mattresses on the floor. If there's no electricity, then you can't run the ventilators and you can't run the incubators and you can't run the anesthetic machines. And a hospital the size of the Shifa Hospital, with the kind of severely injured patient that it has, without electricity, this hospital will just turn into a mass grave. These people will die, there's no doubt in my mind. 14 trucks is nothing compared to what is needed. What is needed is a continuous humanitarian corridor that allows us to evacuate the wounded, to bring in the kind of supplies that we need, the fuel that we need, and we need a ceasefire so that we can treat the patients that we have.
I'll move now to introducing our next speaker, Ms. Juliana Nassar, who is an advocacy officer with the World Health Organization in the occupied Palestinian territories. Her work focuses on attacks against healthcare workers and healthcare institutions and the availability of health services in the West Bank. Please go ahead, Juliana.
Thank you, Sausan. I'm going to share my screen, so please just let me know if everyone can see it. Share. Okay. Can everyone see my screen?
Yes. Yes, no.
Yes. Okay. So good morning, everyone. My name is Juliana Nassar. I'm an advocacy officer with WHO. And today I'm going to talk about attacks on healthcare in the occupied Palestinian territory. To give a quick outline of what I will discuss today, I will start with a quick overview of the current situation in the Gaza Strip and the West Bank. I will then talk about the context of health, just as a background to show the vulnerabilities faced by the occupied Palestinian territory even prior to the escalation of violence that occurred on the 7th of October, like many of the students mentioned also. I will then go through attacks on healthcare, the definition of attacks on healthcare as WHO defined it, followed by a trend analysis of our monitoring. I will then talk about the impact of the current escalation and WHO's monitoring of recent attacks on healthcare. Finally, I'm going to mention a few key asks from WHO to the duty bearers. Gaza is currently facing an ongoing large scale of bombardment, mass displacement of 1.4 million people. The siege that has been implemented severely restricts the entry of essential supplies, including fuel, food, water, medicine, medical disposables, and equipment. It also severely restricts the entry and exit of humanitarian personnel, and it severely restricts the evacuation of sick and injured. In the West Bank, also, we are seeing increased settler and military violence and restrictions on movement, including between Palestinian towns and into East Jerusalem and Israel. And there continues to be a forced displacement as part of the longer-term trend in Area C, H2, and East Jerusalem. According to reports that WHO received from the Ministry of Health up until end of 1st of November 2023, in Gaza there were 9,061 fatalities. Among these, we had 55% were males and 45% were females. And from all these fatalities, 42% were children. In addition, there were records of 22,911 injuries, with 34% among children. Reports to the Ministry of Health suggest that there are 2,060 people missing under the rubble. And according to the Ministry of Health, this, of course, is an understatement because not everyone is able to report their missing. From these reports, there is 1,150 children. Reports from the Ministry of Health on fatalities in the West Bank, there are 130 fatalities in the West Bank and 2,100 injuries. This is a quick timeline just to show you of key events that happened in Gaza since the 7th, but this doesn't mean that there isn't an event happening on a daily basis, but these are just key events. As everyone knows, on the 7th of October, the escalation of violence started. On the 9th of October, a full siege on Gaza was implemented, in addition to the blockade that was already. Evacuation order from north of Gaza towards south of Gaza started. On the 17th of October, as mentioned by also the students, there was an attack against Al Ahliya Arab Baptist Hospital. This doesn't mean that other hospitals were not targeted or bombarded in the past, but this was the most severe one. On the 21st of October was the first humanitarian convoy that entered Gaza. And as we heard Dr. Setta say, that there were only 14 trucks, while in general on daily basis, there's between 400 and 500 trucks entering into Gaza. On the 24th, WHO was the first organization to deliver supplies north of Wadi Gaza, because many of you heard that the supplies that entered into Gaza were forbidden from reaching north of Gaza. WHO was able to provide supplies to Al-Shifa Hospital. On the 27th, the ICRC was the first organization to cross into Gaza with medical staff and medical and wash supplies. On the 28th, which I'm sure many of you saw, IDF announced the start of the second phase of the land invasion, and there was a complete communication blackout on that day. On the 1st of November, which is yesterday, we saw the first evacuation of injured through Rafah, and that was a number of only 76 patients confirmed injured by the Ministry of Health. The impact of the conflict. In terms of displacement, numbers are changing rapidly. Of course, the movement from the north of Gaza towards the south of Gaza was not possible for hospitalized patients and injured. There are reports that Gaza population are starting to move back to the north following explosions in the southern governorates. Out of the approximately 1.4 million internally displaced people in Gaza, there are 689,000 based in 150 UNRWA-designated emergency shelters. Around 122,000 are sheltering inside hospitals, churches, and other public buildings. If you see photos of hospitals, you will see that all the corridors of these hospitals and the courtyards and everywhere are filled with internally displaced people, making it difficult also for health workers to respond to the injuries. Between 550,000 and 600,000 internally displaced people are residing with host families. In terms of the context, now this is just to show you that prior to the current violence, which imposed additional burden on the Palestinian health system, the health system in the occupied Palestinian territory was already facing vulnerabilities, affecting the availability of healthcare. So this was impacted by the economic and administrative and geographical fragmentation, in addition to chronic shortages of essential medicines that were already reported mainly in the Gaza Strip, even prior to the escalation on the 7th. The lack of availability of services to certain services within the MOH lead to high dependence on referrals to non-MOH facilities. With the Israeli bureaucratic permit system, which many of you heard of, the blockade on Gaza, which the students talked about, which is more than 17 years now, and the checkpoints and barriers across the West Bank, access to healthcare remains a huge challenge to patients and healthcare workers and ambulances. Finally, attacks on healthcare and the use of force against medical missions also imposes an additional burden to healthcare. Now, WHO defines an attack on healthcare as any act of verbal or physical violence or obstruction or threat of violence that interferes with the availability, access, and delivery of curative and or preventative health services during emergencies, which is a broad definition, as many of you can see, and this means that everything that is happening can be considered an attack on healthcare. WHO is reporting under a global surveillance system for attacks on healthcare, and this is a global and standardized systematic approach, which is currently implemented in 18 countries, and it's a public dashboard for everyone to see. Just to show you a trend analysis of actually attacks that were happening even prior to the 7th. So WHO has been recording attacks on healthcare from 2014 in the occupied Palestinian territory. Here I'm showing you a trend analysis from 2016 until today. you will see that the relationship between attacks on healthcare and the context are very close. So with every increase in attacks and escalations between the public, you see an increase in attacks on healthcare. So if we were to follow the blue line, which shows Gaza, you will see that in 2018 and 2019, Gaza witnessed a peak in attacks on healthcare, and that was in correlation to the Great March of Return. Another peak was witnessed in 2021, and that was during the 11-day war in May on Gaza. And now we are seeing a new peak in 2023. There are peaks if you follow the orange line in front of you with the West Bank, and that is in relation to the increased escalations across the West Bank that started in 2021 and continued until this day. So before 2023 started, everyone was saying that 2022 witnessed the highest number of Palestinian fatalities since OCHA started reporting killings of Palestinians in 2005. And this you can also see with a high number of attacks reported in Palestine. So 187 attacks were recorded across the occupied Palestinian territory, and with the majority happening in the West Bank, because most of them were related to incursions across the West Bank. You'll see that October was witnessing also in 2022 the highest number, and that is in relation to the incursions into Nablus, into Jenin, and also the closure of Shafat refugee camp, which is based in East Jerusalem. Now, data from attacks on healthcare in 2023 prior to the escalations in October. So you'll see that most of attacks were reported in the West Bank, and most are also related to the incursions. July and February witnessed high numbers of attacks, and that's in relation to incursions in Jenin refugee camp, in Nablus and its old city, and in Tulkarem refugee camps and other areas across the West Bank. Now, attacks on healthcare since the 7th of October. On your right, you will see an information sheet that's produced by WHO, but this was produced until end of October. I just added it here so you can see a visual of how WHO is presenting its figures. But on the left, I'm going to show you the most updated figures that we have on attacks on healthcare. Between 7th of October until the 2nd of November, WHO recorded and verified 216 attacks on healthcare. 93 of these were in the Gaza Strip. These involved the killing of 16 healthcare workers killed while on duty. Now, we might have heard other numbers, which also include 137 healthcare workers that were killed while not on duty and with their families. But according to WHO's surveillance system, those that were killed while on duty were 16. 30 healthcare workers were injured also while on duty, and 28 ambulances were affected, including 25 going completely out of service. 39 health facilities were affected, and 22 hospitals sustained some form of damage, whether it was partial or full damage. 123 attacks were recorded in the West Bank, and these led to the injury of 15 healthcare workers, and 102 ambulances were affected. These ambulances were affected by 70 were affected by obstruction of access, and 62 were subject to some form of violence, whether it was shooting on them or searching the ambulance or attacking the ambulance physically. 19 ambulances were subject to some form of detention. The ambulance was detained and its staff was detained for some time before they were allowed access to injured. 12 ambulances were militarized and searched. This also shows you a trend of day by day. So you can see that there's a peak on the 12th, a peak on the 19th, a peak on the 22nd, and these are all related to a peak in escalations during these dates. Now, unfortunately, the surveillance system of the WHO is an incidental system, so it does not cover the structural violence. So here I'm going to talk to you about the structural violence that also has a huge impact on the health system. The evacuation order that I mentioned, which started on the 11th, it didn't only impact the population living in this area, it also affected 23 hospitals that were ordered to evacuate in Gaza City and north of Gaza. Several of these hospitals received orders for immediate evacuation, including Al-Shifa, Al-Quds, and others. I'm just mentioning Al-Quds as an example. Al-Quds Hospital in Gaza City is currently treating 500 patients and is hosting more than 4,000 internally displaced people, and it's receiving daily evacuation orders by the military. The total bed capacity for these hospitals in the north is estimated at 2,000 beds, and we're talking about emergency bed capacity. There are 11 hospitals in the southern part of the Gaza Strip, amounting to only 1,500 beds in terms of capacity. They are already overwhelmed, so these hospitals in the south don't have the capacity to accommodate the influx of patients from the north if the hospitals were to evacuate. The evacuation is putting the lives of hundreds of patients in extremely vulnerable and life-threatening situation. The ongoing war has an impact on the health system and the functionality of hospitals and primary healthcare clinics in the Gaza Strip. Out of 50 Ministry of Health primary care health facilities, 32 had to close, including 2 due to severe damages. The others had to close due to security reasons or lack of fuel and lack of power supply. 14 primary healthcare centers for UNRWA out of 22 were forced to close. These primary healthcare centers had an estimated supply of less than a month for the remaining. Hospital capacity. There are 14 hospitals according to WHO's database on hospitals that are non-functional, and there are additional 2 outpatient specialty centers that are non-functional, amounting to the 16 the Ministry of Health is talking about. 22 hospitals sustained some form of damage, partial or severe damage, including, for example, the Turkish hospital that everyone spoke about and Al-Ahli Hospital. On the 28th, as I mentioned, during a night of intense bombardment and ground incursions in Gaza, patients and civilians were subject to a total communication and electrical blackout, which had an impact on their access to healthcare. Civilians and injured were not able to contact ambulance centers. Delayed access of ambulances to reach injured was reported to WHO. It was also reported that some of the injured civilians were forced to walk to hospitals, and this is how hospitals discovered the locations of other people's injuries. No communication between hospitals and ambulances was happening, and first aid responders reported that they relied on the sound of the bombardment to establish the location of the injuries. Of course, we mentioned that a lot of hospitals are currently not functional, and then we have a few that are still functioning. Out of the 7 Ministry of Health functioning hospitals, there are 3 hospitals that have already reached their maximum bed occupancy, despite increasing the capacity that they already had. The average hospital occupancy rate for these 7 hospitals has reached 126%, and that's, of course, an underestimate. Hospitals are operating above their normal capacity. Of course, as mentioned by others, in addition to the needs that patients and injured are facing in Gaza, there remains the access needs of the patients with chronic conditions. There are critical shortages of medicines, putting lives of cancer patients at immediate risk. Between 900 patients with cancer need evacuation for treatment outside of Gaza immediately, including 50 children. Before the 7th of October, around 100 patients were referred on a daily basis outside of Gaza for specialized care. All these patients have been unable to exit Gaza since the 7th of October. The West Bank is also facing difficulties in terms of health access. Over 300 patients per day required permits to cross from Gaza into East Jerusalem and Israel health facilities. These patients have been reduced and restricted to only cancer and dialysis and life-saving cases. And the companions have been reduced from 2 companions to 1 companion only. Of course, there are capacity needs in the West Bank and East Jerusalem, the high demand for emergency medical supplies at hospitals, the broader movement restriction, which is affecting the access to primary care and to hospitals, limitations on mobile clinics to access areas in Area C, the limitations to reach major urban centers with closures. There are also Palestinians stuck from the Gaza Strip inside the West Bank. Since the 7th of October, we have around 500 workers that are stuck in the West Bank. We have around 400 patients in hospitals, and at least 80 patients and their companions are sheltering in the West Bank and cannot go back home since the start of the 7th of October escalation. WHO's key asks is that WHO calls for an immediate humanitarian ceasefire and end to hostilities. And we also call to unimpeded and sustained safe humanitarian access for supplies and personnel to all parts of the Gaza Strip. This includes the entry of fuel, which is vitally needed to sustain hospitals, ambulances, and to pump and desalinate water. Thank you, everyone.
Thank you so much, Juliana, for this very comprehensive presentation of data. Basically, like for us to really understand the scope of the tragedy that we are witnessing. We had a couple. First, I wanted to thank you for also bringing up the issue of structural violence and displacement, and this outrageous situation that we face where a government asks a hospital to evacuate because it's planning to bomb it. I'm not sure how can anyone who is touched by public health or who has taken any like basic course in public health, anyone who can basically absorb that and accept it. We've been asked if you can share your slides because it has a lot of information that people would like to spend more time looking at. So if you can let us know if it's possible.
Yeah, of course, I can share the slides, but the data will be outdated by tomorrow.
Yes,
because
yes,
it keeps
absolutely.
Updates based on the reports that we are receiving.
Yes, absolutely. Thank you so much. Our next speaker is Mr. Ahmed Jibril, who's the head of the emergency medical services in the West Bank for the Palestinian Red Crescent Society. And he's also a spokesperson on response and attacks on health. Mr. Ahmed will speak in Arabic, and I will do my best to translate as accurately as possible to English. So please, تفضل أحمد.
أسعد الله صباحكم. أعتذر بالبداية أنني سوف أتحدث باللغة العربية. بالبداية أحب أن أشكركم جميعا على هذه الاستضافة التي تعطي للموضوع أهمية أكبر من خلال ما يحدث في فلسطين بشكل كامل.
Thank you very much. Good morning. I apologize that I'm going to speak in Arabic, and I want to thank you for inviting me to speak about this important issue.
بالبداية أود أن أشكر الزميلة جوليانا على طرح الموضوع وتوثيقه بشكل كامل في الضفة الغربية، حيث تبذل جهود كبيرة لتثبيت هذه الانتهاكات بحق الطواقم الطبية.
I would like to thank Juliana for presenting this important data, this comprehensive data, which shows the extent of the violations that are going on.
يعني أنا راح أتحدث بعمومية عن الانتهاكات بشكل كامل في فلسطين المحتلة، وبالتحديد في بعد 7 أكتوبر.
I will speak about the violations that are taking place in Palestine, but focus on the period after October 7th.
يعني نتحدث عن انتهاكات مستمرة منذ عام 87 على الطواقم الطبية وبالتحديد في الهلال الأحمر الذي أنا أمثلها منذ 27 عام.
I will speak about the violations that have been taking place since 1987. And I have been involved in this work for 16 years. If you 27 years. He's been involved in this work for the past 27 years.
يعني الانتهاكات التي يتعرض إليها الطواقم الطبية وبالتحديد سيارات الإسعاف تكمن في 3 انتهاكات.
The violations against healthcare workers, particularly ambulance personnel, can be put in 3 categories.
أول هذه الانتهاكات هي الاعتداء على الطواقم الطبية بشكل شخصي، من اعتداء لفظي أو اعتداء جسدي أو إطلاق الرصاص بشكل مباشر على الطاقم.
The first kind is personal attacks that are physical or verbal, or even shooting directly at healthcare workers or ambulance drivers. Yes, go ahead. تفضل.
ثاني هذه الانتهاكات هو الاعتداء على السيارة بشكل مباشر، إما بإطلاق الرصاص الحي أو الرصاص المطاطي أو الغاز.
The second type attacks on the ambulance cars by shooting at them live ammunition or rubber bullets or even gas. Yeah.
ثالث هذه الانتهاكات وهي المنع من الوصول إلى المرضى والمصابين في أماكن تواجدهم، وهذا يشكل خطر كبير على حياة المرضى والمصابين.
The third type is preventing ambulances from reaching patients, which puts the lives of patients at risk.
يعني نتحدث بالفترة الأخيرة عن زيادة في عدد هذه الانتهاكات كما أسلفت الزميلة جوليانا، وبالتحديد هي استهداف الطواقم الطبية واستهداف المرافق.
What we're talking about is an increase in these violations or attacks on healthcare workers, health institutions, and ambulance cars.
في غزة الكل شاهد الاعتداء بشكل مباشر أمام أعين الكاميرات بقصف سيارة إسعاف تابعة لجمعية الهلال الأحمر الفلسطيني، مما أدى إلى استشهاد 4 من زملائنا وبعد تنسيق مع الصليب الأحمر الدولي.
We have seen direct violations and attacks in recent days, whereby a car from the Palestinian Red Crescent was directly bombed and resulted in the killing of 4 of our colleagues.
بعد ذلك تم الاعتداء على معظم السيارات في قطاع غزة، إما بإطلاق الرصاص أو القذائف بشكل كامل، مما أدى إلى إخراج مجموعة من سيارات الهلال الأحمر عن الخدمة.
Also recently there have been more attacks on ambulances, destroying these ambulances and resulting in a large number not being functioning.
الكل يعلم أيضا أن جمعية الهلال الأحمر لديها مرافق عدة في قطاع غزة، وأهم هذه المرافق هي مستشفى القدس التابع لجمعية الهلال الأحمر ومستشفى الأمل.
So the Palestinian Red Crescent, it's very well known that they have hospitals in Gaza, including Al-Quds Hospital and another hospital called Jama'at al-Amal, the Organization of Hope.
هذه المستشفيات وددت بشكل رسمي من قبل جيش الاحتلال والطلب منها إخلاء هذه المستشفيات بشكل كامل.
These hospitals have received formal official threats from the Israeli army, and they were requested to evacuate.
وهذا كله مخالف للقوانين والأعراف الدولية التي تحرم الاعتداء على المستشفيات والطواقم الطبية.
This is, of course, in violation of international humanitarian law that prevents attacks on healthcare workers and health facilities.
لكن جيش الاحتلال للأسف الشديد انتقل من مرحلة التهديد إلى مرحلة التنفيذ.
However, the occupation forces, the Israeli occupation forces, have now moved from the phase of sending threats to the phase of actually implementing their threats.
يعني الآن بدأ ينفذ في إطلاق الرصاص في محيط مستشفى القدس، وقبل قليل أدى إلى إصابة 2 من النزلاء من النازحين إلى مستشفى القدس نتيجة استهدافهم بالرصاص بشكل مباشر، أدى إلى إصابة 2 داخل المستشفى بالرصاص الحي، واحدة بالصدر وواحدة بالبطن.
So they have shot near Al-Quds hospital. Israeli bombardment and shooting has taken place near Al-Quds hospital, and two of the people who have sought shelter in the hospital have been injured. One of them in the chest.
هذا المستشفى يتعرض يوميا إلى قصف عنيف في محيطه، يعني أدى إلى القصف على مسافة 20 متر تقريبا، مما أدى إلى إصابة في أجزاء معينة من المستشفى، أدت إلى تناثر الزجاج وإصابة مجموعة من المواطنين النازحين داخل هذا المستشفى.
So this hospital, Al-Quds hospital, has been under attack by the Israeli army. They have shot from a distance of 20 meters on the hospital, and which resulted in destruction and the shattering of glass in some areas of this hospital.
وقبل قليل أيضا تحركت سيارة إسعاف إلى الموقع، وعند الوصول أطلق جيش الاحتلال الرصاص على السيارة، مما أدى إلى إصابة ضابطي إسعاف، واحد رصاص بالكتف وآخر رصاص بالرجل، نقل إلى المستشفى في استهداف آخر للطواقم في هذا اليوم.
Only recently, an ambulance was shot at. The Israeli army shot at an ambulance, which resulted in the injuries of two of the personnel operating that ambulance. One was shot in the shoulder and one in the leg.
يعني احنا نتحدث عن انتهاكات مستمرة باتجاه الطواقم الطبية والمراكز الطبية بشكل كامل، بالضبط أيضا هناك اعتداءات على الطواقم الطبية.
We're talking about persistent, ongoing violations against medical personnel, not only in Gaza but also in the West Bank.
يعني أتحدث عن دير شرف قبل ساعات من الآن، وأثناء قيام المستوطنين بإحراق محلات ومنازل في بلدة دير شرف، توجهت سيارة إسعاف من أجل إنقاذ أطفال قاموا بإطلاق قنابل الصوت والغاز اتجاه سيارتي إسعاف، مما أدى إلى عرقلة وصولهم إلى هؤلاء الأطفال.
Just a few hours ago, in a town called Deir Sharaf, settlers attacked Palestinian homes and burnt them. And an ambulance went there in order to save children who were injured. And then this ambulance was shot at.
يعني احنا نتحدث عن الطواقم الطبية بشكل عام، لدينا 150 إصابة من الطواقم 150 شهيد من الطواقم الطبية فقط في غزة، إضافة إلى مجموعة من الإصابات لا زالوا داخل المستشفيات يعالجون.
To date, there are 150 medical personnel in Gaza who have been martyred, who have been killed. And there's also a number who are injured and who are receiving treatment currently.
الآن نتعرض إلى انتهاك آخر ومهم، وهو عدم إدخال الوقود إلى قطاع غزة بالتحديد. هذا يؤدي إلى انتهاك آخر جديد بحق الطواقم الطبية.
Another violation, of course, is not allowing fuel into Gaza, which impedes the work of medical personnel in general, but I would add myself the ambulance personnel.
يعني نتحدث عن توقف مجموعة من سيارات الإسعاف نتيجة نفاذ الوقود بداخلها.
A number of ambulances are out of commission, are not working anymore because of lack of availability of fuel.
كذلك الأمر بعض المستشفيات سوف تخرج عن الخدمة نتيجة توقف إمدادها بالوقود. السبب الرئيسي أن الوقود شيء مهم هو انقطاع التيار الكهربائي منذ بدء العدوان على قطاع غزة ب7 أكتوبر.
Of course, some hospitals are also going to close down and can no longer function because of lack of fuel and lack of electricity.
يعني نتحدث أيضا عن شيء مهم وخطير حدث في الآونة الأخيرة، وهو انقطاع الاتصالات في قطاع غزة بشكل كامل، وهذا أثر على عملنا أيضا.
Also, we talk about the disruption of communication channels, which took place, which happened over last weekend, which also disrupted the work of medical personnel.
الكل يعلم أن رقم الطوارئ هو تابع لجمعية الهلال الأحمر، هو رقم 101. هذا الرقم الذي يستنجد به المواطنين في الظروف الطبيعية، فما بالك بالظروف الغير طبيعية.
So everyone knows that number 101 is basically the number that people call for the Palestinian Red Crescent in emergency situations. Yeah. تفضل.
هذا الرقم انقطع عن المواطنين في قطاع غزة لمدة 36 ساعة قبل 3 أيام، وبالأمس انقطع منذ الساعة 4 فجرا إلى الساعة 12 ظهر أمس.
So this number was disrupted. So people couldn't reach this number for a period of 36 hours last weekend. And just yesterday, the number was also disrupted. I mean, being able to contact the Palestinian Red Crescent was disrupted from 4 a.m. to 12 noon.
هذا أدى إلى عدم تمكن المواطنين من الوصول إلى رقم الإسعاف والطوارئ، وهو أمر في غاية الخطورة.
This resulted in people not being able to reach the Red Crescent, which is a very dangerous situation.
عملت طواقمنا في قطاع غزة ومن ناحية القصف التي تتعرض إليه قطاع غزة بالتوجه إلى مكان القصف من خلال النظر والسمع.
So the ambulances were trying to reach people who need help through hearing and seeing rather than being called on the phone.
لكن المرضى وحالات الولادة والمرضى المزمنين ومرضى الكلى لم يستطيعوا التواصل مع سيارات الإسعاف بسبب انقطاع الرقم 101.
And basically patients who needed chronic disease help, such as chronic disease treatment, such as kidney dialysis, were not able to reach the Red Crescent.
يعني بالأصل أنه المواطنين يذهبون إلى المستشفيات بسياراتهم، مما أدى إلى انقطاع الوقود، فيضطر أي مواطن الاستنجاد برقم 101 وهي سيارة الإسعاف.
So people then started to use their own cars to take patients or the injured to the hospital, which also led to to exacerbated the situation of lack of fuel because they were not able to contact ambulances.
وهذا يعتبر انتهاك خطير بحق المواطنين.
And this is a violation of rights of people in Gaza.
بدي أتحدث كمان في موضوع المساعدات الإنسانية اللي هي جمعية الهلال الأحمر هي مسؤولة عن استلام هذه المساعدات الإنسانية وتوزيعها على محتاجين في قطاع غزة.
I also want to talk about the humanitarian aid because the Palestinian Red Crescent is responsible for receiving this aid and distributing it in Gaza.
يعني رغم الظروف الصعبة إلا أنه طواقمنا تعمل على معبر رفح لاستلام هذه المساعدات.
Despite the very difficult circumstances, the Red Crescent, Palestinian Red Crescent personnel are working hard at the Rafah border between Egypt and Gaza in order to be able to receive these humanitarian aid and distribute it.
لكن الآن احنا بنتحدث عن إمكانية توقف دخول هذه المساعدات نتيجة نقص الوقود في الشاحنات التي تنقل المساعدات الإنسانية إلى قطاع غزة.
However, now it might be very difficult to bring in and distribute this humanitarian aid because of lack of fuel. And basically the trucks don't have fuel to bring in this humanitarian aid inside Gaza.
الآن بدي أتحدث عن الضفة وبالتحديد بعد 7 أكتوبر.
I also want to talk about the West Bank now, particularly after October 7th.
الضفة الغربية قطعت إلى أوصال وأغلقت المدن بشكل كامل من خلال حواجز، إما حواجز إسمنتية أو حواجز حديدية أو أتربة، سواتر ترابية.
So the West Bank has been cut into pieces because the Israeli army has put checkpoints to prevent people from moving from one area to another.
هذا كله أدى إلى صعوبة تحرك سيارات الإسعاف للوصول إلى أماكن المصابين والمرضى.
This has prevented ambulances from being able to reach people who, the people who are ill or injured from reaching them.
بل على العكس هناك أماكن منعنا من الوصول بشكل كامل مثل بلدة حوارة التي تعرضت بالسابق إلى الحرق حيث الآن لا نستطيع المرور من هذا الشارع.
In fact, they've been intentionally or they've been prevented from reaching the town of Hawara, which in the recent past has been subjected to attacks and burnt. Some homes were burnt there.
كل يوم هناك اعتداء على سيارات الإسعاف إما بإطلاق الرصاص المباشر أو بالاعتداء باللفظ أو الاعتداء بالضرب.
Every day, the Palestinian Red Crescent ambulance personnel are subjected to attacks, intimidation, and in many cases, verbal intimidation and assault.
الجنود اللي على الحواجز يتعاملون مع الطواقم الطبية بطريقة عنجهية جدا.
So Israeli soldiers at checkpoints are very disrespectful and treat ambulance personnel in a very condescending and inappropriate manners.
أيضا هناك شيء مهم وخطير هو مرضى غزة الذين هم متواجدون بالضفة تلقوا العلاج بالمستشفيات في الضفة لا نستطيع إعادتهم إلى غزة.
Another important issue is that there are some patients from Gaza who are in the West Bank now who are unable to return back to Gaza.
أيضا المرضى الذين يعالجون في القدس الشرقية في مستشفيات القدس الشرقية الآن يمنعون من الذهاب إلى المستشفيات في القدس الشرقية.
Also patients who in the past used to be able to access healthcare or treatment in East Jerusalem are now prevented from that.
يعني هاي حقائق جزء من مجموعة من الانتهاكات التي يتعرض إليها الطواقم الطبية في الضفة وفي قطاع غزة أمام أعين العالم.
This is only some of the violations that medical personnel experience in front of the world while the world is witness.
يعطيكم العافية.
Thank you very much. شكرا كتير لك أخ أحمد. Thank you so much. This was a very important intervention. And I hope that my translation did it justice. But we will move now to our last speaker. Last but not least, Mr. Timothy Fish Hodgson, who is a senior legal advisor on economic, social, and cultural rights and disability rights at the International Commission of Jurists. Please go ahead.
Hello, thank you everybody for speaking so far. My presentation will be shortened, especially because of the great presentation from our colleague at the World Health Organization, who has sketched out the factual basis and the statistics, which really paint the breadth of the picture that colleagues here who are healthcare workers are talking about. And the shocking thing about one of those graphs that was presented is that there's a recorded 200 different attacks. We see in the media, the occasional report on a very big bombing of a particular hospital, and then we often can have in our minds across the world incidents of attacks on things needed to protect the healthcare of Palestinians in Gaza and the West Bank, but really it's part of the war operation that is currently going on, a consistent part of it, and a consistent part for decades. I work for the International Commission of Jurists as a human rights lawyer, as I've been introduced, but I think I should say in the start also, it's important to say that I am here in South Africa. I'm a South African human rights lawyer, and I'm also a Jewish person with family in Israel. And I'd just like to say to begin with that that none of what is said by the state of Israel represents people all around the world, and the government of Israel should stop talking on behalf of people who are very much against what is happening in the country and in the occupied territories. So with that said, on behalf of the ICJ, I will make a presentation. We have been working as the International Commission of Jurists in Israel for a long time, and you can go and find the work that we've done online, and I'll refer to some of it. But one thing that strikes me always in this situation when we're talking about healthcare workers is how recently many of those who are justifying attacks on healthcare facilities and healthcare workers were celebrating publicly healthcare workers during the COVID-19 pandemic. And really, we now are trying to justify creating conditions that are unworkable for people to access health directly after learning that healthcare of every single individual is connected to healthcare of other individuals. And Palestinian healthcare is really literally our healthcare, and it's a lesson that we should have learned. And without an ability to provide healthcare services and without the ability to provide other social services, there really is no way for us to say that we are enjoying any human rights anywhere in the world. I think that I want to make a point. It's quite difficult, especially because everything so far that's been said about violations and human rights is accurate. And as an international human rights lawyer, it's difficult to come in and try and make a technical argument when the arguments that have been made and the positions put forward are so stark and so clearly all human rights violations. So I'm not trying to withdraw from that. But maybe there can be some value in thinking about what international human rights law and international humanitarian law say specifically about some of these things. And perhaps I can provide some context for that. There are three ways that I can see that Israel in particular is violating the human rights of all people in the occupied territories. The first is a failure to make positive provision as an occupying power of healthcare facilities. We forget about this because I think that there's nobody in the occupied territories who has any hope for whether or not Israel will comply with these obligations. But based on Israel's own occupation of Gaza and the West Bank and all other territories that they occupy, it has taken on obligations as an occupying power to provide all social services, including healthcare, in terms of international law. And failure to provide and make provision for facilities that are adequate for every single person and to protect the healthcare positively of every single person is a violation of these obligations. Secondly, as has really been recorded repeatedly, destroying existing infrastructure and killing healthcare workers is quite obviously also a violation of the right to health because it decreases the ability of people to access healthcare fundamentally and decreases their ability to live and to live with any dignity. Thirdly, there is a violation that is caused by preventing access to aid. And you could really say this about very many different rights, and we'll come to that. But when it comes to healthcare, preventing access to any aid and any equipment and any resources that could be made available to protect people's health. And I'm not just talking about from the bombs that are being dropped in the occupied territories. I'm also talking about, as colleagues have raised, chronic, ordinary healthcare needs of the population of the occupied territories. Preventing access to aid to that is a violation of international human rights law and the right to health, as well as international humanitarian law, which also provides for the need to provide for medical services. in international law, there's a duty to respect, protect, promote, and fulfill the highest sustainable standard for health, and to provide, thereby, a right to life with dignity. Healthcare must therefore be available, accessible, affordable, and in sufficient quality. Really, one of the problems, and I'll come back to this about the way that we talk about human rights sometimes, is that we try and use them as a band-aid. But what the right to health actually requires is much more. It requires full accessibility of quality healthcare services of all types in the occupied territories. Again, because Israel is an occupying power in the occupied territories, all healthcare services that it makes available in its own country, within the borders of Israel and not in the unlawfully occupied territories, it should make available within the occupied territories. And otherwise, it is discriminating and it is not making healthcare equally accessible. So this is a violation of that. When we talk about civilians and combatants, this is a term in international humanitarian law, which is really quite a simple term, but seems to be deliberately misunderstood in the media globally. There is no justification in international law whatsoever, irrespective of the circumstances and irrespective of what's happened before, of targeting civilians. And I know that the argument is made often by Israel that it is not targeting civilians, but it is having to do something and therefore killing civilians. But this is simply not true. In international humanitarian law, it is quite clear that doing anything which will invariably harm, injure, or kill civilians is targeting civilians. And therefore, fundamentally, it's not really even a difficult argument to make that international humanitarian law is being violated. Of course, collective punishment is also a violation of international law, a well-known violation. So inflicting punishment on some for the behavior of others, regardless of how good or bad the justification may be for inflicting punishment on some, is not legal in terms of international law. And Israel is repeatedly violating the obligation to not inflict collective punishment. I spoke about it before. I think that sometimes when we give words to things like lockdown during the COVID-19 pandemic or blockade, it seems a little bit more normal, as if this is like a legitimate tactic. There is no way and there's no space in international law for blockading humanitarian equipment of any kind. Blockade should not be misunderstood for a technical term which is permitted in some instances and denied in others. Blockades of humanitarian goods are always illegal in terms of international law. Then I want to make a last point, which is about the level of what rights require. We see interesting comments coming from the US government about calling for a pause, which just on the plain language of it, I really don't understand, because is there an intention to press play again on the horrific and grave injustices that are being committed in the occupied territories flagrantly in violation of international law? We also see language which suggests that the allowing of any aid in, and so we have already spoken about today, the ICRC being allowed to provide very limited amounts of healthcare equipment and facilities as far as aid is concerned, and calls for a certain number of vehicles to be providing a certain amount of aid to be provided. That is not the requirement. All states are required in international law to protect fully human rights. And the amount of aid that is required to protect human rights is astronomically above the amount that is currently being let in to Israel. And any argument and any consideration of negotiating on that or bargaining for the number of aid vehicles, humanitarian assistance that can be provided is clearly not based in international law and a violation thereof. If I can move on, just so that I can make the point clearly, it may be useful because colleagues here are involved with things that are maybe more directly important, but just to capture some of the things that have been said by the United Nations and different officers in the United Nations, the current UN Special Rapporteur on the right to health has underlined the fact that racism and any form of racial discrimination is a key social determinant of health and a driver of health inequality. And really, I think that we can see here, and it's not only Tim's opinion, there are many different United Nations treaty bodies that have called what is happening in the occupied territories a product of systemic racism and discrimination of other forms, and they are producing and driving health inequalities that are occurring between Israel and the occupied territories and within the occupied territories. The UN Special Rapporteur on Palestine has said, and I quote, Israeli settler colonial occupation and apartheid practice are causing violations of people's rights. This, by the way, incidentally, what I can say as a South African is that it's often said by the Israeli government that there's an objection on behalf of South Africans to using the term apartheid to describe what's going on in the occupied territories. And this has very little or no support from South Africans. I can tell you that much. Many, if not most, South Africans see what is going on as very directly paralleled to what occurred here for decades. The UN Special Rapporteur on the Right to Health and other special rapporteurs have warned about the mass ethnic cleansing and pled for the prevention of genocide. These are not polemical political calls. These are special rapporteurs whose only duty is to take the human rights in treaties and ask for them to be realized and suggest how they are realized. And they are using words like this, and I think they must be taken seriously. Most recently, the UN Human Rights Office has said given the high number of civilian casualties and the scale of destruction following Israeli airstrikes on the Jabalia refugee camp, we have serious concerns that these are disproportionate attacks that could amount to war crimes. This may not be something which is not obvious to most people who are looking onto the situation and looking onto the events, but it is a big statement to come out of the United Nations Human Rights Office, although a little bit late in the day. It's already been covered by colleagues, things to do with electricity access, fuel access, food access. But it's important to say that from international law perspective, the so-called social determinants of health are part of the right to health. The realization of the right to access to food, right to access to energy, and the right to access to fuel in order to be able to transport and to be able to operate health systems and other social relief systems is part of those rights, and violations of those rights too. I will make one last point, which is that I have been in the US, and I spoke recently on a panel for Columbia University School of Health also. I can't not comment as a human rights lawyer on what appears to be going on university campuses around the US. It's very clearly against the First Amendment in the US, against academic freedom, against the principles of international law, to try and suppress the ideas of academics and students. And I'll repeat what I said in that webinar. Any university that is scared of the ideas of its academics and its students is simply not a university, and cannot be said to be a center of the production of knowledge. And I would call on all universities to encourage conversations and dialogues exactly like this. And to allow for people to be able to speak about what's going on so that we can understand what's going on and address it. As a human rights lawyer, this is pivotal. Other than that, I would just like to thank the organizers for organizing this event. To the WHO, I think that it's very, very useful for us to be able to see these cold, hard facts about what is going on, and documenting the violations that are being experienced and reported on the ground by all others. I'm sorry if there is something that I haven't covered, and that also, if everything that I've said is quite simple and straightforward, it's quite difficult to try and put a technical lens on what is really grave violations of human rights, which are so simple for the world to see, and really should be stopped immediately, and then not paused, but never continued.
Thank you so much, Tim. You've covered so many grounds, actually. And it is very important for us to really understand human rights law and international humanitarian law, because international law is on the side of Palestinians in this case. Power is on the side, is somewhere else, unfortunately. And I also, in relationship to your comment about university campuses, the American Civil Liberties Union sent or published a letter yesterday that basically said exactly what you just said, and in terms of the suppression of free speech, and in fact listed some cases in the past that they've worked on where they have been able to defend free speech on US campuses. And work against those who try to suppress it. So we have a few minutes left for questions, for comments, and I invite you all to please write your questions in the Q&A or even your comments. There are a few really positive, supportive comments in the chat, in the Q&A, I'm sorry. So if you have any question or comment, please write it in the Q&A. But I also want to mention one question and the response to it for everyone, in case you missed, in case others missed it. But there was a question asking about why, for Juliana, for the WHO speaker, why is the incidence of healthcare attacks higher in the West Bank than in Gaza? And Juliana's answer is that our verification depends on direct communication with the affected partners in order to consider an attack confirmed. Currently, our partners are overwhelmed with the response and the gravity of attacks. I'm assuming this is in reference to Gaza. We know that many attacks are currently missed. The communication blackouts are also affecting our verification. We continue to try and verify additional attacks with our partners, and we hope that when there is a ceasefire, we will be able to verify incidents that we missed. So that is important. The blackout on communication has dramatic implications on everything that is related to the provision of healthcare and being able to collect accurate data in real time. Okay, so we will make this recording available, and Juliana has indicated that she will make the slides available with the caveat that the numbers might be, not might be, but will most likely be different. I have a question, or let me just pose a question from one of the attendees, anonymous attendee, of how can we help? And I see that my colleague David Mills has responded to that. Through advocacy, calling or sending a letter to your local officials. Keep an eye for events as well if you would like to donate to the relief efforts. The Palestinian or Egyptian Red Crescent, medical aid for Palestinians, or UNRWA. Would anyone, أحمد في سؤال بيسأل إنه كيف فينا نساعد؟
يعني احنا المساعدة الأساسية هي الضغط على المنظمات الدولية من أجل وقف الاعتداءات على المؤسسات ومراكز الإسعاف وسيارات الإسعاف.
So an important way of helping is to pressure international organizations in order to stop these attacks on healthcare workers and basically the first responders.
يعني لا يعقل انه نشاهد الاعتداء على المستشفيات وسيارات الاسعاف في شتى حروب العالم. لم نسمع ان يوجه رسالة تحذير لمستشفيات من اجل اخلاءها.
It's unbelievable what is happening, and in many of the other wars we have never seen a situation where a hospital would receive a formal threat to evacuate because it will be bombed.
أيضا لا يعقل استهداف سيارة إسعاف بعد خروجها بتنسيق من الصليب الأحمر مع جيش الاحتلال أن تقصف.
And it's not acceptable that an ambulance would be shot at or bombed after they would have coordinated with the international, مع الصليب الأحمر العالمي قصدك, with the international, with the Red Cross, and in coordination even with the Israeli army.
يعني رسالتنا الآن هي على الأقل إدخال الوقود إلى قطاع غزة من أجل استمرار عمل المستشفيات وسيارة الإسعاف وكل شيء يتعلق بالحياة في قطاع غزة.
So our message is to allow humanitarian aid to enter, and particularly fuel, so that we can get back to being able to function and to save lives.
كذلك الأمر الضغط من أجل فتح ممر إنساني من أجل إخراج المصابين في حالة الخطر إلى الدول المجاورة.
Another message or another call to open a humanitarian corridor to allow the injured to go to other countries to receive treatment, medical care. Yeah.
نعم.
Shukran. Thank you. Okay. Well, I want to thank everyone for attending and for the positive notes. Dr. Jennifer Leaning from the FXB Center for Human Rights comment is excellent review of international humanitarian law and international human rights law just now, absolutely crucial for everyone to understand. Yes. Okay. Thank you so much. I mean, I have to say that I hope we don't need to organize another webinar to address a catastrophe, to talk about a catastrophe such as what is happening right now. But I want to thank everyone for their participation. All the speakers, particularly the speakers who are not in offices and who are on the ground, the former students of the Palestine program course, and all the attendees as well. Thank you.